Sometimes the laser can be a confusing subject for patients, and I have a hard time kind of getting across what each modality of this laser can do. This is my Sciton Jule Laser. It is kind of a one unit that encompasses multiple different procedures. So I'm going to break it down into two separate modalities of treatment. One is the broadband light laser, part of the Sciton Jule platform. And what the broadband light laser is that this laser can take the visible spectrum of light and can filter it into individual wavelengths using these small filters here that we plug into a handpiece here. And when we fire the laser, when it comes out through the crystal right here, one wavelength of light comes out instead of the whole visible spectrum. And what we know about the each wavelength is that different wavelengths will target what we call chromophores. And what chromophores is basically just a fancy word for pigment. So you may have a problem with brown pigment in your skin, sunspots, perhaps freckles that you don't like, which I don't actually understand because I think freckles are very cute, but sometimes people don't like their freckles. Sometimes you may have telangiectasia, which are kind of the broken blood vessels that people have around their nose. It's very good. Certain filters will target rosacea. It's very good for that. And each wavelength of light, and we have 6 different wavelengths here that we could focus onto the skin, will target different chromophores and give us a different effect. When we talk about a photofacial, what we are talking about is a treatment sequence of different wavelengths that will apply in series to the skin. So we'll start off globally by taking the handpiece and we'll start with, say, a 560 filter in the handpiece, and we'll apply it over somebody's face first. That 560 filter is going to target all the red pigment in somebody's face. So if they have rosacea or a lot of those broken blood vessels, it'll target all that. Once we're done with that, we'll change out the filter and put on, for instance, this 515 filter. The 515 filter is the filter that's going to give us the wavelength that targets brown pigment spots, and we'll apply that over the face to really target those age spots and freckles as needed. And we do these treatments in sequence until we've really targeted every problem chromophore that somebody has in their skin, and that's a photofacial. So when I do photofacials, I do like to recommend that people do a series of, say, 3 to 5 photofacials at a time, because you're not going to have some miraculous cure for every brown spot, and we have to increase the dose of light each time. We have to do it safely so that you don't get burns on your skin. So we start at a very low dose, and then we increase the dose of light sequentially as you come back for more. And I like to think of it as sort of weeding the garden. You have to go in and weed the whole garden and get rid of all the problem things. And then after, a series of maybe 3 to 5 will get you to the point where you need to be. And then you go into a maintenance phase. And that's where I'm talking about weeding the garden. So you've gotten everything cleared out and your skin is looking peaches and cream, but those brown spots and those red spots are going to gradually come back, because you're going to live your life, you're going to be out in the sun, and the brown spots are still there. We've kind of just knocked them back. So we put people into a maintenance phase where they will have done their series of, say, 5 photofacials, and then once a month or once quarterly, depending on how you want to do it, you would come back and get kind of a booster photofacial treatment and just kick everything back. That, in addition to good skincare, and I could completely transform your skin to a beautiful peaches and cream complexion that you had when you were, say, 20 years old. So that's what we recommend, really standard for really anybody can undergo that treatment. What we also have noticed through studies, and these are biopsy-proven studies, that people who do a sequence of these treatments, who do them regularly, they have an alteration in the DNA in their skin. So there was a study done in Beverly Hills by a very well-known dermatologist there who's done a lot of work with the Sciton laser and broadband light laser. And what he did is he took 5 people who were over the age of 60 and then 5 people who were around the age of 20. And he looked at 23 different genes in these people. And in these genes, there was a certain pattern in the 20-year-olds that was different from the 60-year-olds, meaning some of the tumor suppressor genes were turned off in the older population. Some of the genes that transcribe metalloproteinases, which are chemicals that break down your collagen and elastin, were upregulated in the older population. And he matched those from the 20-year-olds to the 60-year-olds. And then in the 60-year-old population, he did series of broadband light photofacials on them over a period of 10 years, and then looked at a biopsy again in that treatment population. And what he found was that in that population who were treated, 4 out of 5 of them reverted their genetic pattern back to match the 20-year-old pattern. So we are seeing that people who do regular treatments with photofacials not only get that visible result of a change in the tone of their skin, but also you're seeing at the histologic level that they get an actual change in the genetic composition back to a more youthful looking thing, which explains why after regular use of photofacials, people are seeing actual reversal of aging. And he has great pictures to show it, and I notice it in my own patients. It's just a lovely treatment, very minimal downtime, not very painful, takes about 20 or 30 minutes, and it's just a lovely maintenance program.